I feel honored to be given this opportunity by SABM to talk on bloodless medicine in Nigeria in the 2021 annual meeting. I do not have any disclosures. Sometimes I wish I had. The objectives of this talk shall be to define bloodless medicine and outline its pillars and benefits. We shall review bloodless medicine in Nigeria and show why bloodless medicine is a practical option for a low-resource setting. I work in University of CALABAR Teaching Hospital in Nigeria, which is a tertiary health institution training medical students, dental students, residents, and other health workers. The interesting thing about that institution is that it has a multidisciplinary bloodless medicine and surgery team. CALABAR itself has friendly people in it. They love dressing up in traditional outfits and dancing in the streets long before carnivals became popular. CALABAR is in the southeastern end of Nigeria, just beside the neighboring country, Cameroon. And Nigeria itself is a West African country off the Gulf of Guinea, with a population of about 206 million as of 2020, according to the World Bank. So Nigeria is there in West Africa, and we are going to talk about why and how we are placing bloodless medicine on the front burner in Nigeria. Now, let's start by defining bloodless medicine. The Bloodless Medicine and Surgery Society defines bloodless medicine as the provision of quality medical care without the use of allogeneic blood, with the aims of improving clinical outcomes and protecting patients' rights. It is synonymous with transfusion-free medicine and encompasses bloodless surgery. So sometimes it is expressed as bloodless medicine and surgery. It is a multidisciplinary practice involving all the major specialties of medicine, as well as nursing and other health disciplines. And it involves the combination of techniques in a multimodal fashion, tailored to the individual patient. Now, this seminal article by these fathers of bloodless medicine, Goodenough, Shanda, and Spence, in Transfusion, the May 2003 edition, defines bloodless medicine as emerging clinical strategies for medical care without allogeneic blood transfusion, and is a well-defined area in blood management. So it's very clear that it involves avoiding allogeneic blood transfusion. If you note this article from Transfusion Medicine Review by Block and Associates, says blood transfusion safety in Africa. Blood safety remains an important public health concern in Africa, where lack of availability or provision of unsafe blood adversely impacts morbidity and mortality in the region. They note that in addition to the major transfusion transmissible pathogens encountered in the industrialized world, like HIV, HBV, HCV, syphilis, which are the only ones we test for, several other agents with either established or theoretical transfusion risk are endemic to Africa. None of them are ever tested for, like simple things like malaria, filariasis. These are all endemic and blood-borne, but they are not tested. And from page 5 to page 11 of this article, the authors devote time to talk about pathogens that are peculiar or particularly endemic in low-resource settings in Africa. How bad is it in Nigeria? This article of June 14, 2021, The Guardian, says 95% of donor blood units used in Nigeria are unsafe. Experts warn. Who are these experts? The World Health Organization, the Nigerian Medical Association, and the National Association of Resident Doctors. They noted that HIV 1 and 2, syphilis, hepatitis B, hepatitis C, and other deadly infectious diseases are responsible for making blood in Nigeria unsafe. The WHO had already noted in 2002 that simple alternatives to transfusion are safer, less expensive, and may be equally effective. Now, these are Nigerian authors, Usoro and Charles, in the Journal of Blood Medicine, mentioning the need for the development of alternatives to allogenic blood in order to meet the challenges of blood transfusion in sub-Saharan Africa. They pointed out old and emerging threats of transfusion-transmitted infections. But of course, they noted that the adverse effects of allogeneic blood transfusion on their own should prompt a review of transfusion practices. And yet another Nigerian author in the Nigerian Medical Practitioner points out the alternative. The alternative is bloodless medicine and surgery as a viable alternative in a scarce blood resource environment. I did a Google Scholar search of patient blood management in Nigeria. And for the period between 2001 and 2021, I had only 4 articles. And out of the 4, only 1 was actually focusing on patient blood management. Above all, that article was not from Nigeria. It was from Cameroon. It only mentioned Nigeria in passing. If you scroll further down, still on that search, you find articles on blood transfusion, healthcare waste management in Nigeria, and so on. In other words, you get the impression that nothing is happening in Nigeria as far as blood management or patient blood management is concerned. However, a search for bloodless medicine in Nigeria between 2001 and 2021 actually yields 21 articles on that deal directly with bloodless medicine and surgery. Some of these articles have to do with techniques such as acute normovolumic hemodilution, intravenous ion therapy, and some other techniques. Some are case reports like this one that deals with bloodless management of severe obstetric hemorrhage, where the NADI hemoglobin was 1.3 grams per dl, and this case was successfully managed without blood transfusion. This other article is a cohort study comparing the outcomes of 20 Jehovah's Witness patients with 45 other women who received blood transfusion. Note what the authors, Chibu and others, wrote here. The study adds evidence that major operative procedures can be carried out on Jehovah's Witness patients without blood transfusion or blood products. Yet another study here compares 23 Jehovah's Witnesses with 46 non-witnesses. The non-witnesses received blood for elective abdominal hysterectomy. And they, again, made very important conclusions here. Gynecologists in poor resource settings should consciously aim at providing bloodless care for all their patients undergoing abdominal hysterectomy. They're obviously quite enthusiastic about bloodless care. And this author, Wokoma, in the Nigerian Health Journal 2009, actually advocates for the integration of bloodless medicine and surgery programs into the healthcare system in sub-Saharan African countries. He points out the high seroprevalence of HIV, hepatitis B, C infections in sub-Saharan African populations such as Nigeria. And he also points out the lack of availability of free blood for transfusion in Nigeria. And then he advocates the adoption of bloodless medicine and surgery and its integration into the healthcare programs of sub-Saharan African countries such as Nigeria. He says that bloodless medicine and surgery programs are not for the sole service of the Jehovah's Witness group anymore, but for the generality of humanity. And he quotes James Isbister, who is widely credited with first coming out with the term patient blood management. He quotes him, "A blood transfusion was previously seen as the gift of life, but the tables have been turned. The general perception now is that bloodless surgery and avoiding blood transfusions may be the gift of life." And so Wokoma advocates for the establishment of a national body, such as a National Bloodless Medicine and Surgery Agency, at the level of the National Ministry of Health. Well, we are not holding our breath for that. We have already, on our own, started the Bloodless Medicine and Surgery Group in CALABAR in 2007. It's domiciled in the University of CALABAR Teaching Hospital, and I believe is the first multidisciplinary bloodless medicine and surgery group in a public hospital in Nigeria and even in Africa. We are all volunteers, and 3 of us are actually SABM members. We have been successful in our clinical care, and we've been organizing educational activities such as this one-day symposium. You can see a SABM member here, Brenda. Some older SABM members may remember her. She came to Nigeria to help us with this seminar. And we went on to expand it to 1 week full program. You can see the one we held in 2018, and the SABM president then, Dr. Peter Tibi, also came and gave very insightful talks during the program. We have a Bloodless Medicine and Surgery Society, which is actually an international society now, promoting safe and quality healthcare delivery without the use of allogeneic blood transfusion. Again, a multidisciplinary society. We promote May 16 as World Bloodless Surgery Day to increase awareness on bloodless surgery or the benefits. And we have had 6 annual meetings so far. The last live meeting we had, and you can see no less a person than the SABM president, Sherry Ozawa, in attendance, and Dr. Arieshanda also. So last year, we had to go virtual, of course, and our annual meeting hosted some SABM members as well. We had Dr. Spies, Dr. Gross, and Sharon here, as you can see. Now, something interesting is that there is a new Bloodless Medicine and Surgery group about 300 kilometers away from us. It was formed in 2020, that's last year, in OWERRI. It's domiciled in the Federal Medical Center there, and is the second multidisciplinary Bloodless Medicine and Surgery group in a public hospital in Nigeria. It is headed by a plastic surgeon. You can see him on the extreme right, Dr. Isi Guzo. And last year, they held a successful 3-day webinar on bloodless medicine. Again, there was SABM participation. You can see Kevin Trentino in that picture. This year, there is going to be a meeting November 3rd to 5th, 2021. And the theme of the meeting is safety and quality of care as the drivers for bloodless medicine. So in conclusion, bloodless medicine is associated with improved clinical outcomes. The medical literature testifies to the active, growing, and successful practice of bloodless medicine in Nigeria, which is a low-resource setting. Blood transfusion in such a setting as we are in is beset with grave issues of blood safety, shortages, and high costs. That is in addition to the general issues of adverse outcomes and questionable efficacy. Bloodless medicine comes with added benefits of complete absence of transmission of blood-borne diseases and lower costs, which even the WHO is telling us about. Bloodless medicine is therefore rightly on the front burner in Nigeria as a practical way to improve clinical outcomes, limit disease transmission, and lower the cost of healthcare. I would like to acknowledge the SABM 2021 Annual Meeting Committee, Jessica Varisco, Rita Schwab, the SABM President, Sherry Ozawa, Dr. Shanda, Dr. Spies, Dr. TV, Dr. Frank, the Bloodless Medicine and Surgery Group in my center, and also in FMC OWERRI. Thank you very much.